Before we get started, I want to say that I have been on the phone this afternoon with Representative Diane Hart. She is up in Tallahassee, and she just wanted to share that she has been working with local businesses here in their dealing with the coronavirus and the continuing restrictions on their businesses. So we are very, very lucky to have incredible representation in our city. We have State Senator Janet Cruz, we have Congresswoman Kathy Castor, and from Tampa General, we have Dr. Lakshmi, who is an infectious disease specialist. So all those questions will go to her. So I would like to introduce now Senator Janet Cruz, who, as we all know, is a fighter for Florida's children and our most vulnerable.
Good afternoon, everyone, and thank you for being here. Before I begin, I'd like to thank our mayor, Jane Castor, for her proactive approach in keeping all of us safe, and also our Congresswoman Kathy Castor, because we're working together. This is a group effort, and I will really honestly warn everyone that we don't know what we don't know. And because a patient could not, you couldn't even express symptoms for almost 12 days and not realize that you're out and infecting people. And if you think you're young and you'll be okay, and your kids are young and they'll be okay, I ask everyone to think about your grandparents and think about your parents and think about those whose health is somewhat compromised. Please don't be selfish. Please stay at home. I saw pictures of crowds on the beach today and was honestly surprised. So I ask you again, please don't be selfish. Please think of others, both in keeping everyone safe and in groceries. And when you're buying groceries, please think of others. I'm here to talk mostly, though, about the Small Business Emergency Loan Program, and I want to thank the governor and all of the legislators for working so hard on this program, and it will be available to small business owners statewide. We have appropriated $50 million for the program, and small businesses can apply for these bridge loans at FloridaDisasterLoan.org, FloridaDisasterLoan.org. Additionally, Florida Medicaid covers and will cover all medically necessary services required to facilitate testing and treatment of the COVID-19 virus. ACA will waive limits on services that need to be exceeded in order to maintain the health and safety of recipients diagnosed with COVID-19, or when it is necessary to maintain a recipient safely in their home. More information on Medicaid services can also be found on the Agency for Healthcare Administration website, and that website is ahca.myflorida.com, ahca.myflorida.com. Floridians whose employment has been affected by COVID-19 can apply for what we're calling the Reemployment Assistance Benefits. Individuals who are separated from their employment because of COVID-19 will file for reemployment assistance benefits in the same manner as individuals who are unemployed for reasons other than COVID-19, and the same way that they file for benefits. We also await more information from our federal partners, and I'm sure that Congresswoman Castor will talk about that. We are hopeful that these assistance benefits will be expanded. We have currently committed $300 million in the state budget to fight the spread of COVID-19. I'm headed to Tallahassee on Thursday to vote on the final budget. But I think it's important to let you know that I've been in the legislature for almost 10 years, and we've been very good stewards of the taxpayers' money. We have reserves, and we have anticipated events like this that will take a large portion of our budget. Therefore, we have reserves that should cover that. But if necessary, we're prepared to go back to Tallahassee when we're not in session to make adjustments to make sure that we're fully funding what's happening here in our state. So I thank you very much, and I'd like to introduce Congresswoman Kathy Castor.
Well, thank you, Senator Cruz. Mayor Castor has often said that one of the reasons the Tampa Bay area is such a special community is because we come together at times of challenge. And this is a time of challenge, and we will get through this together because we're a resilient community, we're a strong community, and as Senator Cruz says, we're going to look out for one another and for our neighbors. I have some important information for working families across this community, but I wanted to highlight the fact that the Congress has passed 2 emergency aid packages for coronavirus response. First, 2 weeks ago, the Congress passed an $8.3 billion emergency aid package that does a few things. It speeds preparedness dollars to our state and local public health agencies so that they can respond. It also provided $3 billion for the diagnostics, testing, therapeutics, and vaccine development. No one is satisfied with the progress on that front, however. And it provided another $1 billion for medical supplies and medical surge capacity, particularly for the personal protective equipment that you'll get an update from Dr. Lashmi on. That aid package also provided up to $7 billion for our small businesses to get the no and low interest loans to get them through this crisis. For the small business community, it's going to be a local, state, and federal partnership to help guide you through the coming weeks. Senator Cruz highlighted the most important way for you to enter into the process right now is to go to the Small Business Administration Florida disaster loans and begin to fill out the paperwork. Keep your, all of your business records will be very important. Now for working people, the House of Representatives on Saturday night passed the Coronavirus Families First Response Act. This is quite important for all of our neighbors. It will provide free coronavirus testing whether you have insurance or you don't. We have a lot of military families in the Tampa Bay area, no cost to them. We have a lot of veterans in the Tampa Bay area, no cost to them. In fact, the James Haley VA and the other VA hospitals are screening currently. And if you are a veteran or your family has a veteran, I encourage you to call 1-877-741-3400 for screening. For all the veterans, they would like you to check in first on screening before you arrive at a VA facility. That way you can get the best advice. That emergency aid package also provides robust food assistance that now is getting down to the local level for our schools, for the school districts to ramp up what is typically their summer feeding programs, but will be ramped up early next week. Thankfully, the City of Tampa and Mayor Castor will be strong partners on those food assistance programs. That will include Feeding Tampa Bay and all school districts across the state of Florida. It will also provide funds to Hillsborough County government and our local aging services agencies so that they can transition to directly delivered meals for our older neighbors rather than have them come to the senior centers or the congregant facilities. Importantly for working people, the Coronavirus Families First Act will provide new emergency paid sick leave so that you can take leave and avoid spreading the virus, or you can take care of a family member. The emergency paid sick leave will provide 2 weeks of paid leave, 100% of your normal salary. It includes part-time workers as well. For anyone that is told to quarantine, anyone who has symptoms, anyone who is trying to get a test. It applies to all government employers as well. Some of the largest employers in the Tampa Bay area are Hillsborough County government, the City of Tampa, MacDill Air Force Base, USF, St. Pete College, HCC. They're government employers. This emergency paid sick leave will apply to those employees. It also applies to employers with 500 employees or less. Large corporations should have their paid sick leave policies in place, and taxpayers shouldn't have to reimburse those major corporations for paid sick leave. For the small and medium businesses, the government will reimburse those employees, will provide the paid sick leave for 2 weeks at their normal wages. That emergency aid bill also provides for paid family and medical leave on top of the paid emergency leave. Paid family and medical leave will provide up to 12 weeks leave for anyone who must stay home to care for a child. When school goes back in next week and parents have to stay home because kids are going to be home from school. Spring break is not going to stop, and then everyone goes back to normal. It's anticipated that schools will be out for at least another week or two. Those family members can take their paid family leave at that time. There's also benefits for self-employed and small medium businesses to cover the cost that they will incur by providing paid sick leave and family leave. If this goes on for a number of weeks, the Congress has authorized enhanced unemployment insurance benefits. The Families First Act gives the state of Florida the resources and the flexibility to provide unemployment benefits to you if you are laid off, or if you're furloughed, or if you exhaust your allotted leave. But here's the kicker, and Senator Cruz knows this well because she's been fighting on this account for a long time. The state of Florida is the stingiest in the country when it comes to unemployment benefits. Most states provide 26 weeks of unemployment benefits. In the state of Florida, only 12 weeks. So the members of the congressional delegation have asked Governor DeSantis and state leaders to expand that 12-week unemployment insurance benefit to at least 26 weeks, and we may have to go beyond that from there. Those are some of the highlights in the emergency aid packages from the federal level, but it is focused on families first, our local small businesses first, and taking care of our neighbors right here in Tampa. Dr. Lakshmi.
Thank you, Mayor Castor, Congresswoman Castor, and Senator Cruz for giving me the opportunity to speak today. I believe times of crisis brings the worst and best in us as human beings. We stand here to provide you a united front and a resource in times of distress. So I'm going to talk a little bit about the preparedness of Tampa General Hospital. Tampa General Hospital is prepared to care for our community in the event of a COVID-19 surge. Tampa General has ability to perform in-house COVID-19 testing for our team members, our physicians, and our patients. We have deployed a pandemic plan. The pandemic plan has 3 phases and is triggered by each surge from phase 1 to phase 2 to phase 3. Our current protocol is that any patient who presents to our ER with symptoms consistent with COVID-19 is triaged appropriately and isolated appropriately and gets tested. If we see an increase in these types of patients, we will place them in a dedicated containment area to prevent transmission in a healthcare setting. If the increase in patients surpasses the capacity of a particular unit, we're going to have a 3rd phase of the pandemic plan executed, where the patients are going to be triaged in an outdoor area that is designated and is being coordinated to set up. Our team is well trained and our facility is well equipped to handle these patients while keeping our patients safe, along with our team members, physicians, and visitors. We have adequate supply of equipment and personal protective equipment at this time to care for our patients. In an effort to keep our team members, physicians, and patients safe, we are limiting visitor access at this time to Tampa General. We have decreased the number of entry points from multiple locations to 5 locations. Anyone entering the hospital will be screened. No visitors who are ill and have international travel or been exposed to a patient with COVID-19 will be allowed to enter the hospital. At 9 p.m. tonight, we will implement much more stricter visitation rules. The number of visitors per patient will be restricted. Adult patients may have one support person with them if they want them to come into the hospital. Pediatric patients, including in the neonatal ICU, they can have both parents present. For our obstetric patients, we're going to allow a partner and a certified birth attendant that could be present during the delivery. Also at this time, we have had to make the difficult decision to stop all elective surgeries for our international patients and out-of-the-state patients. We are doing all of this work in partnership with the CDC as well as the Florida Department of Health, with whom we are in constant communication and have been our guiding resources. Our CEO continues to speak with Governor DeSantis, Mary Mayhew, Secretary of Florida Agency for Healthcare Administration, as well as local elected officials, including Mayor Jane Castor, Congresswoman Castor, and Senator Cruz. Last, we are committed to being transparent with our team members, physicians, and community. As this is an evolving situation, we'll continue to monitor the situation and follow the CDC and Department of Health guidance very closely. On an ending note, I want to say the things that Senator Cruz mentioned and emphasize something. I think it's very important we come together on this front. We have a moral and social obligation to protect our vulnerable population and our elderly population. I think we have to act together in a cohesive manner to provide a united front and be the first line of defense. Thank you, everyone.
Thank you all very much. We have been working around the clock to keep our community safe and informed. And we are in constant communication, as has been said here, with our local, state, and federal leadership, including Congresswoman Castor, Senator Cruz, and all of the CEOs of the different hospitals to be able to secure resources and support for our community. And in addition, in some cases, I speak several times a day to individuals in our community, including Jared Moskowitz, who is a state emergency manager, Dr. Holt, who works for the Hillsborough County Health Department, and several others, as I stated, the CEOs of our hospitals, to see that what we can do proactively and aggressively to prevent the spread of COVID-19. Every morning at 8 a.m., my entire staff has a meeting to talk about the different issues affecting our community, both with the COVID-19, but also the economic impact that that has on our community and what steps we can take to minimize this. This is an unprecedented time in our city, and it requires quick action and tough decisions that prioritize the safety of our residents, our workforce, and our entire community. And we've been taking critical steps every day to protect Tampa and fight the spread of coronavirus within our community. Here's just a few highlights of the actions that we've taken to date. February 27th, Tampa held its first joint press conference with Hillsborough County to discuss our preparedness measures. March 1st, Florida Department of Health reported the first cases of COVID-19 in Florida, including one in Tampa. The number of cases since then have clearly risen. As of this morning, we were up to 192 confirmed cases of coronavirus in Florida. And I want to emphasize that those numbers are woefully, woefully underestimated. On March 2nd, we participated in a press conference with Senator Cruz and Governor Ron DeSantis and several medical experts to, again, discuss the rising concern for coronavirus in our state. On March 9th, the City of Tampa launched a new platform to synthesize critical information and resources, including FAQs and information on coronavirus symptoms prevention, event cancellations, updates, and more. This information can be accessed from our website, tampagov.net, and that all is kept up to date minute to minute. On March 10th, we visited all long-term care facilities in the city, providing them with written guidelines on steps to protect their patients, in addition to providing a personal contact in the event that they had any questions or concerns. On March 12th, I convened the executive staff from our 4 main hospitals, Tampa General, Baycare, Advent, and HCA, to discuss testing capabilities and setting up remote collection sites. On March 12th, I declared a state of emergency to streamline the process of getting critical resources to our city and our residents. Since then, we have been canceling public events, closing our parks and rec facilities, and suspending programming, and setting up feeding locations in parks for out-of-school children, and I'll talk a little bit more about that in a minute. I've also been working with Congresswoman Castor. We have been on the phone with her. Just as she has done every day that she has represented our community, she is front and center on this issue here. So we've been working with her to secure relief for our small businesses during this challenging time. Sunday, we curtailed long events and had our police officers visit over 100 bars, establishments, mostly bars, providing them with a city directive and ensuring that they complied with it. Yesterday, as you all know, Governor DeSantis held a press conference to announce the $50 million bridge loan program, and we launched Tampa Biz to ensure we're getting resources like these to our small businesses as quickly as possible. And any small businesses are encouraged to text Tampa Biz to 888-777 to receive real-time business resources and updates. And to that point, we've taken a number of our city attorneys. I'm going to talk about call centers that we have set up. And we've taken a number of our city attorneys to help walk people through the process, because it's a difficult application process. We understand the severe burdens on our small businesses, restaurants, and service workforce. We understand what they're facing, and we want you to know that we are here for you, our community is here for you, and we are working around the clock to find relief options to minimize the impact of COVID-19 while protecting the health of our community. To date, we have put together a social service task force. We assembled this task force of nonprofit organizations working together to bring resources to our citizens. The task force is currently assessing the community's needs and how best to meet those needs collectively. The city is also developing online social service directory to help connect residents with service providers, and all of that information will be available on our website this afternoon. And Congresswoman Castor participated very heavily in that. Food provision. Beginning Monday, March 23rd, Hillsborough County School District will have 21 feeding sites, 7 of which are in the city, and you can visit Hillsborough County Schools website for further details. In addition, we have started feeding our school kids at 6 different locations in the city, and those locations are all on our website as well. We intended to keep our stay and play open in the parks, and we had food donations for that. Ultimately, we had to make the decision to close the parks, and so we're still making that food available. Congregate meal sites are temporarily closed, and we're working closely with service providers to ensure seniors and individuals with special needs continue to receive meals through alternate methods like home delivery. Our parks have been closed, but the outside spaces are still open. The Economic Recovery Task Force continuing again to work with state and federal partners to provide economic relief to our local businesses. Again, we're working to help all of our businesses apply for that $50 million in bridge loans, because that is a first come, first service. And then we're also taking proactive steps to ensure businesses are aware of what's available. We've already emailed more than 1,000 businesses information on how to apply for the grant and how to get in touch with us if they need any further service. We're also assembling a team of employees who will work with Small Business Development Center to help businesses overcome the technical barriers of application processes. We have implemented teleworking in the city of Tampa. We have 4,500 employees. We have 25 teleworking licenses, remote licenses. So we will have a number of people working from home. We've also suspended those tasks where there's interface with the citizens, and we're bringing those employees in to man these call center phone banks that we're putting together. And so the call centers will be up and running later this afternoon, and again, you can find all that information on our website. There is no doubt that this virus is spreading very quickly throughout our community. Testing capabilities are very limited, and as a result, we do not have an accurate count of how many people in our community are currently infected with the coronavirus. My suggestion is take precautions as if you and everyone around you already have this virus. This is the only way we can flatten the curve and possibly save some lives in our community. For more info, you see the Tampa Biz on the back, 888-777. Text Tampa Ready to 888-777. And as I said before, we also have Tampa Lista for our Spanish-speaking public. Text Tampa Lista to 888-777 for any information. We are all facing this together, and we will get through this together, even if it means we have to spend some time alone. Thank you all, and we'll open it up for questions now.
Mayor, it seems like, viruses in the past, like H1N1 and stuff like that. Why such a proactive approach now? Is it because the virus is more contagious?
It's the ease with which the virus is transmitted, and as was stated, so many people are walking around with the virus and they're asymptomatic, but they can still spread that virus on to others. And the only thing that's going to stop that is social distancing and washing hands and not touching your face.
And Rick Scott had tweeted out post-transparency contact with you. You guys are in need of protection.
Yes, we would like to open up, and we've been prepared. We've been in talks with TGH and all of the other hospitals. Baycare is very prepared as well. But we are in a position where we can open up a remote testing site today, but we don't have the necessary PPE or the necessary collection kits. And that's why there's such a limit on the number of tests that are being done right now. And I'm sure Doctor could probably talk more about that, but I would say if there are 100 tests a day being done in our entire community, that's probably a high estimation, where we should be doing hundreds, if not thousands, a day.
Do we know how many people in Tampa have been tested so far?
No, we don't have the total number, unless you know the total number. The number that we got today was 192 confirmed cases today. There's another issue too. The hospitals can test. The health department has the capacity to test 50 a day. They're waiting for equipment to ramp that up. Tampa General Hospital is in the same position, and they're awaiting equipment so that they can dramatically increase that number. If you don't have a Tampa General, a Baycare, or the health department in your community, then those tests have to be sent out to either LabCorp or Quest. And the time frame to get those back now is 5 days and climbing, to be honest.
Do we even have a rough estimate? I mean, are we talking hundreds?
No, there's been over statewide, there's been over 1,000. Here in our community, I would say hundreds.
And did you say that there were 192 confirmed cases in the Tampa Bay area, or just in the state?
Yes. Yes, we have the number, but I'll get it to you. I think it was 32. We'll get it to you. Any other questions? All right. Thank you guys very much.